Hello everyone, welcome to my channel, PharmD School. My name is Ali, and today we will talk about beta blockers and how do beta blockers work. So let's get started. In today's lesson, we will cover four things. Number one, the different types of adrenergic receptors. Number two, agonist versus antagonist. And number three, beta-1 selective beta blockers, and number four, the non-selective beta blockers. When we're talking about the adrenergic receptors, there are so many types of the adrenergic receptors, but there are three types that we will be focusing on today, and it's the alpha-1, beta-1, and beta-2. Alpha-1 can be found in the blood vessels, such as the arteries. Beta-1 can be found in the heart, and beta-2 can be found in the lungs. One way of remembering where each receptor can be found is through their letters. Alpha starts with A, arteries start with A as well. Beta-1, 1 stands for one heart. Beta-2, 2 stands for two lungs, and that is one way of remembering where each receptors can be found. The mechanism of these receptors are very simple. There is a part in our brain called the medulla. The medulla has a gland called the adrenal gland. This gland produces two hormones called the noradrenaline and adrenaline. Whenever these hormones bind to the receptor alpha-1 found in the artery, it constricts the blood vessels, which causes high blood pressure. Now, the same scenario can occur in the heart as well. When these hormones, the noradrenaline and the adrenaline, bind to beta-1 receptors found in the heart, it causes the heart rate to increase, and that leads to higher blood pressure as well. And whenever the noradrenaline and the adrenaline binds to beta-2 receptors found in the lungs, it actually opens up our lungs and dilates, which allows us to breathe better. Now you know the mechanism of each receptor. But it's really important to know that these receptors can also be found in different locations in our body as well. It's really important to know the differences between agonist and antagonist and which one is which. In this example, we see that adrenaline and noradrenaline are binding to the receptors beta-1 found in the heart. So adrenaline and noradrenaline are agonizing the heart. They're acting as agonists, which increases the heart rate. Beta blockers, such as Bisoprolol, are going to block the binding of the hormones to beta-1. They are antagonists. They are blocking the receptors and the hormones from binding to cause the heart rate to decrease. When we're talking about beta-1 selective beta blockers, we're talking about medications that target beta-1 receptors. Remember, beta-1 receptors are found in the heart, and the medications are Metoprolol tartrate, brand name Repressor, and the general dosing is 25 mg to 100 mg QD or PID. And there is a Metoprolol succinate, brand name is Toprol XL, and this is the long-acting version of Metoprolol. This one is generally prescribed as QD, and the general dosing is 50 mg to 200 mg QD. And then there is Atenolol, brand name is T-Norman. This one can be prescribed as 25 mg to 100 mg QD or PID. Last but not least is Bisoprolol. Brand name is Z-Beta. this one can be prescribed as 2.5 milligram to 10 milligram QD. And if there is one thing you learned today is beta-1 medications and Antinolol. Now let's go over the non-selective beta blockers, also known as the non-cardioselective. These medications typically target both of the beta-1 receptors found in the heart and beta-2 receptors found in the lungs. And these medications are the Nadolol, and the brand name is Carvedilol. This medication is typically prescribed as 12.5 milligram to 50 milligram PID. And then there is Propranolol immediate release, or brand name is Antihypertensive. This medication is prescribed as 160 to 180 milligram PID. And there is the long-acting Propranolol LA, or brand name is Nadolol LA. And this medication is prescribed as 80 milligram to 160 milligram QD. And remember, these medications target both beta-1 found in the heart and beta-2 found in the lungs. And typically, we do not want to block beta-2 found in the lungs because it can cause shortness of breathing or difficulty breathing. So this can be one of the side effects. It may be rare, but it can be one of the side effects in these medications. Alright, this is it for today. Thank you for watching. If you did like this video, please leave a like and share this video and subscribe to my channel.